Thyroid hormone. Let's take a big breath before we start the thyroid hormone. Thyroid hormone, better known for weight management. Most of the patients who come to me, if they are white, please check my thyroid. Thyroid is my problem, and most of the time they are right. Even if I say no, you could be mad, but they still say that no, it's my thyroid. Patients know. So that's the thyroid, which is located in front of your neck, 2 lobes. Okay? But it is controlled by from the brain. Now, Lily was a child who has a tendency to put on weight when she was little. She had difficulties getting out of bed. She was slow in thinking and understanding, her concentration, and she always had to catch up with schoolwork. She felt cold even in summer. As an adult, her problems worsened. So nobody picked up her underactive thyroid when she was a child, so she continued. And most of us are like that too. She had, face was puffy, she feels swollen, she doesn't lose weight, and her skin and hair are rough and dry, and she has a bad temper, especially in the morning, and she feels and looks depressed. Most of our teenagers, when you go to their room to wake them up, they are in bad temper because at that particular time they need more hormones, and there may be a dip. Thyroid hormone comes in 2 major hormones, triiodothyroxine, which has got 3 molecules. We commonly call that a T3, and T4, which has got an additional iodine in it as well. The T3 is the active form. So what happens is that this is what is produced by the thyroid gland. It gets converted to the active form. This is not active. And then there is a reverse T3, which is also inactive. In some cases, in some conditions, you will find that doctors measure the reverse T3 and it is raised. It is because it doesn't work either. So some of this T3 may not work. And you also get thyroid antibodies that we measure that also attacks your thyroid gland and makes the thyroid sick, and it does not produce the thyroxine hormone as efficiently as it can, or it does not produce it at all. Okay, so just remember those 2 main hormones, and then you have to ask your doctor to measure the reverse T3 as well. It's very important. Normally we don't do it because Medicare does not cover for that. You have to pay it yourself. What is the role of thyroid hormone? A lot of role. It plays a big role from head to toe and all the organs as well. Blood flow, heart rate, heat production, metabolism, speed of thinking, intestinal motility. That's why you get constipated and you don't open your bowels, or you get diarrhea if there is an overactive thyroid. You feel thirsty, you need to urinate. Good cholesterol it keeps a good cholesterol up. So if your thyroid deficiency, your good cholesterol is going to be down, and we need good cholesterol. Immune deficiencies against infections and cancer. Some patients may come up, I get recurrent infections. I just don't get well. I don't feel well, but I don't know what it is. Okay. Beneficially, it decreases the bad cholesterol, the diastolic pressure, the edema, the waste products outside the cells. So when some of these underactive thyroid patients, you'll see that they are a bit puffy and they tend to retain water, and that's the waste products. It also helps to accelerate and eliminate defective enzymes and waste products that are built up inside the cells. Symptoms of thyroid deficiency, handshake test. So when you shake somebody's hand, it feels very cold. Fatigue, a common symptom, dry skin, constipation, difficulty losing weight. I'm doing everything, doctor, but I cannot lose weight. Weight gain, too tired to exercise and unable to metabolize. These patients are too tired, they cannot exercise, they're sore everywhere. Lowered body temperature, lack of energy, fluid retention, depression. Mental health issues are very common with thyroid patients, so any mental health patients, we must check thyroid levels. Memory, anxiety and poor sleep, muscle aches, headaches, pain in the joints, thinning of the hair, dry skin, and sometimes your voice changes. So here is a picture. Brittle hair, dry hair, splitting of the hair, diffuse loss around the front of the hairline. You'll find some edema or swelling under the eyes, and the face looks puffy. There are more signs, eyebrow sign. So the lateral thread, this part of the eyebrow, you tend to lose if you are hypothyroidism. And the puffy face again, and thick lips. Now, what causes the thyroid deficiency? So there is a problem upstairs in the brain, the pituitary hormone, which controls the thyroid gland to produce or tell how much thyroxine hormone to produce. Hypothalamic control, which is also from the brain. The thyroid failure, the thyroid itself cannot produce hormones. The conversion failure from the inactive thyroid to the active thyroid. So there is a problem from here to there, and you build up more of this and less of this, and this is what we want. The receptor uptake failure. Now once it is converted to that, that needs to get inside the cells and make changes, whatever its work is supposed to be done. And there are some receptor cells which just like a magnet sucks it in, and then the cells are able to work. But if there is a receptor failure, that does not happen. It is basically like type 2 diabetes. We have a lot of insulin, but it does not work. Okay? So that's one. And the fourth one is the adrenal insufficiency. So if the cortisol level is low, it affects the thyroid production, conversion, and the receptor uptake. So if the adrenal gland is not working very well, you have the problems all the way. So adrenal support is very, very vital for thyroid deficiencies. So you can do an assessment at home, and these are the tests that we can do. So when we do the test, generally in the GP setting, we don't do all these tests. We only do this test. This test under new concepts, which I'm going to go through, is a useless test. Doesn't tell us much. This is what we want. Okay? And sometimes we want thyroid antibodies as well. These are an additional test to do for thyroid. This is the new concept from the 23rd World Congress, just happened in November 2015. And they talked about the lab test lacked sensitivity. TSH, thyroid stimulating hormone, is not most sensitive test. Normal TSH getting lower all the time. Okay? Free T3 is the best clue. And clinical correlation is required. Now, most of the patients that we say you are normal are not having optimal thyroid function. So if you go and have a test and the doctor says your thyroid levels are within normal range, it may not necessarily be right, because we want optimal levels. Okay? We must see the patient. Another new concept, we need T3 for fat loss. We need T3 to protect against arrhythmias, the irregular pulse rate. We need T3 to reduce stress and dieting. T4 does not necessarily convert to T3. Normally we presume T4 is produced, it must be converted to T3 and it must be taken up by our cells and we should be better, but not necessary. Reverse T3 reverses T3. Hashimotos without hypothyroidism. I have seen a lot of patients come in and they have got normal thyroid, but they have got Hashimoto or thyroid antibodies. They don't have underactive thyroid. The T3, T4, everything is within normal range. So they are very early in the phase of developing full thyroid deficiency. Okay? So if you have a test and the doctor says, well, your T3, T4, everything is normal, you just have antibodies, you have to think seriously. We have to get rid of those antibodies before they start doing something to our thyroid gland. Again, new concept, just replacing one hormone is not enough. We have to replace both. That gives us a better quality of life than just replacing T4. So when we give you the hormone with the prescription conventional medicine, it is only that. We don't normally do T3. Many factors decrease T4 to T3, and that is dieting, stress, zinc, selenium, iodine deficiencies. Some of the cardiac drugs and epileptic drugs also decrease the thyroid function, the conversion. Thyroid and adrenal, they are the best friends. Check cortisol levels, and we must measure them 4 times a day. Just doing one cortisol test in the morning is not enough. So it is difficult or not practical to do the blood test 4 times a day, waking you up at 3 a.m. in the morning. So the salivary gland test is most practical. So we do it between 7 and 9 a.m., 11 to 1 p.m., 3 p.m. to 5, and 1 to midnight. Okay? And we also must support the adrenal fatigue with these vitamins and minerals. These are some of the adaptogens. You probably know of them, ginseng, licorice, and rhodiola. There is an adrenal extract that you can take 2 to 3 times a day. And then this is another mineral. DHEA also helps. And then we treat the thyroid with T3 and T4, and we treat your stress. This is a complete treatment for underactive thyroid, but most of us are only taking thyroxine. Now, T3 is 4 times as strong as T4. So if you are on 100 micrograms of thyroxine, that means we need to add another 30 micrograms of T3. So T3 is very strong. And T3 has got short life, it's hours, whereas T4 lasts for days. So you can't just say that why not I just have T3 and that will be enough. It will be metabolized quickly, and then rest of the day you're fatigued again. So you need both. So all this I'll come to. So all this is part of the treatment. Now, I mentioned that Hashimotos, which is the autoimmune thyroid, the autoantibodies, your own soldiers in your body start to go and attack your thyroid gland and make it sick. So you have this Hashimotos with hypothyroidism or without hypothyroidism. There are elevated antibodies, you still feel fatigue, dry hair, you are nervous and irritable, you have a low quality of life, you can have breast cancer and miscarriages as well. These are the things that support to bring the antibody levels down. So you have your selenium, Brazil nuts, which is on your table, and iodine, vitamin D, and we need gluten-free diet, omega-3, probiotics, and we must control the homocysteine. Homocysteine is our anti-inflammatory marker. Now, when we have high reverse T3, we will have symptoms as well. So brain fog, fatigue, difficulty losing fat, and this most common thing in yo-yo dieting, and we must check for heavy mental and physical stress and other infections. So same thing, we have to support with selenium, iodine, and treat the thyroid gland. So here we got the difference of T3 and T4. T3 has shorter life, 7 hours, and T4 up to 7 days. Patients prefer it. T3 is needed for adequate tissue levels, especially in heart. Because T4 lasts for 7 days, so heart needs it now. This is the amount that we can give you. And benefits of treating the thyroid, underactive thyroid: brain function is improved, cardiovascular function is improved, you live longer, improvement in the inflammation, weight management, and what is the difference between TSH of 4 and 0.4? Now when you look at your test results, they will say TSH 2.5, reference range 0.4 to 4. So if it is 4 and 0.4 and you are sitting somewhere there, the difference between from there, if you go there, is 5.5 kilograms. Okay? So the lower the TSH, the better you lose weight. This is my formula, and this is what I will be giving to my patients for underactive thyroid. So I will correct the thyroid deficiency, I will support the adrenal gland, and I will support the thyroid activation, the conversion from one to another, and I'll give them all this adrenal support as well. Okay. So this is a complete protocol for underactive thyroid. We are at the moment partially treating. Let's recap. It's an important hormone in overall well-being, and it is located in front of the neck, and it is controlled by the brain. Associated with weight management and mental health. We must look at T4, T3, reverse T3, Hashimotos with or without underactive thyroid, and the TSH levels. T4 and reverse T3 are inactive forms and needs to be converted to active T3. T3 hormone is active form. Thyroid deficiency, which is hypothyroidism with a PO, not ER. Underactive thyroid, it requires correction with both T4 and T3. T4 lasts for days and long acting, and T3 is short acting. We must complement or supplement with cortisol, vitamins, minerals are required for the conversion of T4 and T3. Benefits are seen in brain function, cardiovascular function, longevity of life, improvement in inflammation, and weight management. Okay, make sense?